it's clear that we are seeing that the cost of this pandemic is being borne differently by different groups, depending on who you are, where you live, or the type of work that you do. How did we get to this point, and how do we manage our new engagement, or in this more intensified engagement of our corporate community, aligned with good governance to address these inequities?
Thanks, Michelle, and it's great to be with you, Larry and David. As you said, Michelle, we are in the midst of three overlapping and mutually reinforcing pandemics: the triple pandemics of public health, the economy, and racial inequality. And yes, it's not affecting us equally. People of color, low-income communities are the first to suffer and the last to recover. Why? It's because your zip code, as you said, Michelle, earlier, where you live, where you work, your zip code predicts your life outcomes better than your genetic code, not least your health outcomes. And there's a whole school that talks about the social determinants of health and how community investments can really change these impacts on our health and well-being. So these are things like access to affordable housing, healthy foods, education, public safety, even clean air to breathe, and things that we, on our panel take for granted. But these are the social determinants of health that have a far greater impact on our health and well-being than the healthcare system. In fact, if you really think about healthcare, right, the system that we have right now is more like sick care. The vast majority of our health spending, which, by the way, is massive among all the OECD countries, and we have the worst outcomes among the 11 nations, by the way, and the spending continues to skyrocket. The vast majority, like 90%, David, this is your world, you would know, is spent on sick care. Maybe 10% spent on preventative upstream and primary care, let alone social determinants of health. And what are social determinants of health? This is the stuff that's not taking place in the doctor's office or in the hospital. It's stuff that's taking place where health begins, at home, in schools, in the workplace, in our communities. It's the stuff that really matters that doesn't really show up in the healthcare system. And we know that investing upstream in these social determinants of health have massive payoffs, can really bend the cost curves, and importantly, really improve people's lives. And yes, going back to the public sector, Larry knows this. We spend a lot of money in education, in job training, in even homeless assistance services, all kinds of social programs to invest upstream in these social determinants of health. Yet, and we can hopefully spend some time talking about this, yet despite all the spending, trillions of dollars a year, we're not really making significant progress. In fact, one of your colleagues in the Obama administration, Peter Orszag, wrote in Moneyball for Government that only 1% of social spending on the federal spending on these social programs actually yielded outcomes for people. Why? Because our government spends money on outputs. How many hours in a program? How many people are in the classroom? It doesn't really follow people as to what happens to them after these programs. And we can get into why our system is kind of shackled to invest in this way, but spending money on social determinants of health effectively, and I hope that the pandemic has really awakened us all to really refocus our energies in this arena, is really going to be the next focus for all of us.
Tracy, briefly, what your thoughts?
Yeah, I mean, David already talked about the disproportionate impact on women, but you mentioned this extraordinary statistic, Michelle, which is a bright point, right? Amidst this pandemic, we still have 6.5 million unfilled job openings across America. More than half of them are good jobs with advancement potential, with benefits, and more than half of them do not require a traditional 4-year bachelor's degree. These are all what we call the middle skills jobs in the country. You need some training beyond a GED, some short-term credentialing, maybe a 2-year associate's program, maybe a certain type of licensure, whether it's in the skilled trades or in healthcare or in IT. Lots of IT jobs don't need a bachelor's degree, right? So there are all these amazing sectors where they're relatively recession resilient, pandemic resilient, and are still growing. So how do we have more equitable access to these type of career pathways for women? So one of the projects that we're financing at Social Finance, a new career impact bond that we just launched last week in the Pacific Northwest, is with a coding school called Alchemy, where we're actually focused on training women to land jobs in the IT sector that pay $60,000, $70,000, $80,000 a year. Fantastic jobs, middle-class wages with tremendous advancement potential. But women are either through interest or their own predilections, but importantly, lack of access to savings and credit that lock them out of these fantastic opportunities. So finding innovative ways to finance their education and training. Again, this is important, at no risk to them. This is not a loan. It's a different income share repayment process so that more people can benefit from these growing industries is a place that we're really focused on right now.
It's so solutions oriented. I love it. I'd be remiss, Tracy, you got to bring it home. Where should we be investing to address this call to action that Larry so brilliantly brought forward? And then after you, I'll go to David on this.
No, but Larry's absolutely right. It's not just the market's responsibility. It's not just the public square's responsibility. It's how do you bring the best of markets and government and have them work together in service of the people? For better or for worse, the pandemic is a wake-up call to these deep-seated social and racial inequities that we've been seeing for decades. I mean, pandemic or not, and we've been wrestling with quote unquote a permanent crisis, whether it's housing or a job or educational outcomes, and COVID has simply laid bare all these horrible problems. And Michelle, I think the audience knows these statistics well, but let's just reel them off very quickly. How all of us are affected unequally, right? People of color are 3 times more likely to die from COVID, 4 times more likely to be hospitalized than white people. They have more increased exposure to COVID because of the occupation, as David said, because of the industries that they occupy. White people are going back to work much faster than Black workers, and let alone wealth and income inequality. The pandemic has way worsened it. White households hold 85% of the nation's wealth, 4% are held by Black households. And just throughout the 10 months of the pandemic, the 600 or so American billionaires, their collective net worth grew from 3 trillion to 4 trillion. Meanwhile, 46 Americans have basically wiped out their emergency savings. So before the pandemic, 40% of Americans couldn't come up with $400. Now it's way worse. So COVID has simply laid bare all these cracks. And the optimist in me says, you know what? This is a wake-up call to really reinvest in our social infrastructure, our public health infrastructure, so that we can be more resilient, not just in terms of pandemic preparedness, but actually an economy that works for everyone, the stuff that Larry was just saying about equality and opportunities. So areas of investment, of course, we need to invest in all the areas of social determinants of health, but it's also how we invest in them. We've got to look at data and evidence when we think about where to invest, not just relying on gut instincts. We got to really enlist the private sector to help us realign incentives and share risk differently. David was talking about jobs earlier. Right now, our education and training system is completely broken. The risk is borne by the individual. We all go on to take student loans to go to college in hopes of a better life and better economic prospects. But many of us don't graduate or graduate with no useful skills and are saddled by the fastest growing segment of consumer debt, right? 44 million Americans are struggling with student debt. So how do we rethink just in that one segment on education and training finance? How do we actually realign risks and incentives so that it's in service of the people? Schools should have skin in the game. Obviously Harvard is one end of the spectrum, but Harvard's collecting tuition whether or not the graduates are successful at landing a job and keeping the job. The government in spending their dollars need to have more accountability in the system, and the lenders need to also rethink their risk equation. So it's really the approach that we invest in these areas of social determinants of health. It's about using data effectively, course correcting, understanding feedback loops, using the private sector to realign incentive and insert some rigor and discipline in the process, thinking about new ways to realign incentives and share risks. And hopefully we'll it's a bright day, starting on January 20th, to think about how we might put our federal dollars to work more effectively.